This presentation will introduce you to Probe Scientific's MicroEye and sensor system for continuous glucose monitoring, aimed initially at patients in intensive care. The system is designed for glucose monitoring, but could easily be modified to be used for a wide range of analytes and biomarkers. It can be used in a variety of different environments. The current system has been specifically built for demonstrations and is consequently much bulkier than a clinical version would need to be. Probe already has the know-how and a detailed project plan to upgrade the demonstrator to a fully functional clinical unit. The system has been designed either for integration into bedhead array data monitors or as a standalone system.
The system is made up of the following components: the MicroEye body interface sampling device. This uses a standard 18-gauge IV cannula as the entry route to the vein. A standard IV solution, saline or ringers, is used as perfusate, a container of calibrant solution of a known glucose concentration. A pump, typically a standard IV pump already owned by the hospital. A flow cell which houses the glucose sensor chip. A potentiostat to convert the signal from the sensor. A connector may be wireless to a monitor or laptop. We use a laptop for demonstrations, but a PDA works well, as does a connection to a bedhead monitor. The fluid set, MicroEye, cannula, sensor chip and waste bag are disposable after 48 hours. The pump, potentiostat and flow cell are reusable. IV solution perfusate flows via the pump and switching valves through the MicroEye and exits to the flow cell, where it flows across the sensor. It then flows to waste. Flow rates are low, typically between 10 and 100 microliters per minute. The dialysate solution is separated from flowing blood in the vein by a semi-permeable membrane, across which diffusion occurs. The solution then contains small molecular weight biomarkers such as glucose, which are analysed by the sensor. The information from the sensor is converted by the potentiostat and transmitted to a continuous chart on the laptop as glucose concentration. The display is real-time with a delay to the first result of a minute or so depending on the flow rate. Between cycles of perfusate through the MicroEye, the switching valve allows first known concentration calibrant and then the IV, zero glucose, to the flow cell and sensor for auto-calibration. The display therefore shows 3 points on the continuous trace: the fixed known concentration, a zero value and the patient value. This way, if sensor drift or performance changes, then the patient value is automatically recalibrated. Whilst our demonstration system shows all three values, the clinical version will only need to display the glucose value. It will be shown as a continuous trace. It can be linked to a bedhead monitor or to a standalone unit or PDA. The display shows how quickly a change in blood glucose is recognised, firstly as the concentration increases and as it then declines.
We've shown the flexibility of the system and the data that can be delivered. Whilst the demonstrator is large and robust, the much smaller and neater clinical version is only a short development step away and is ready for full-scale commercialization. The results are accurate compared to current techniques and have all the features needed for safe, effective, tight glycemic control. Probe has demonstrated a functional, efficient system that's ready for commercialization now.